So welcome. Today we are here talking about controlling or sustaining or creating health at home. This is part of our Missouri Open Door monthly workshop, which is funded by the Administration for Community Living's No Wrong Door initiative. So University of Missouri, Kansas City teamed up with Missouri Assistive Technology to bring you these practical 1-hour monthly workshops that we hope that you can utilize the information right away in the work that you do. I'm going to quickly go over the Missouri No Wrong Door project, just so that you're familiar with what that is and the language. I'm going to introduce for you a Charting the Life course tool specific to health to get you started in this thinking, and then pass it over to David, who's going to hone in on some specific practical technology that can be utilized for those that you support or for yourself. And we hope that you'll also walk away with some additional services and support strategies you hadn't thought about before. Just a little bit about myself. My name is Sheli Reynolds, and I'm Associate Director here at the Institute for Human Development, where I work on initiatives related to person-centered and family supports, specifically related to the Charting the Life course framework. So I'm excited to be here, not only as a professional, but I come here as a sibling of an individual with a disability. So not only can the information we share with you today be used with those that you support or your family members, everything that we talk about can really be utilized by anyone, whether it's the planning tools or the technology themselves. Just a little bit about No Wrong Door. The concept and phrase No Wrong Door is a federal concept that really is an initiative that's been going on for a number of years in other states that really says, how do we give power to the people that need long-term services? And long-term services could be services for people who are aging, people with behavioral health, physical disabilities, developmental disabilities. But how are we creating ways to inform people so they can make informed decisions? How are we helping people have control over their services and supports? So the No Wrong Door concept is not specific to any one target population. It's specific to people needing long-term services. So whether they need them as a child or an adult or in their transition years to adulthood, and it's not a place. It's a concept of working with organizations and systems to make the front doors of existing organizations more friendly. So we're really excited because we had supplemental funding because of the CARES Act, and we thought we would really leverage that funding beyond only focusing on COVID response. But how can we start creating the foundation and the groundwork to creating a statewide network of entities that are helping people problem solve and get connected to services, so that we have one another that we can rely on when we have questions and we can learn from one another. The other big focus we wanted to work on is well, how can we enhance the skills and knowledge of the staff that work at those entities so that they know more about person-centered thinking and planning, as well as increase their knowledge around technology. The grant also has some innovative projects that I won't go into, but we have a number of innovative projects, one of which I'll tell you about, and there's a picture of David doing it, and it's our robotic pet project, utilizing technology to decrease social isolation, increase, a number of things during COVID is just one of the examples of our projects. So as you can see there, we have many statewide examples, and that's just a list of few. All of your organizations are welcome to be a part of this conversation. To quickly touch on Charting the Life course. Charting the Life course is the framework that we're utilizing to really enhance person-centered practices, policies, and supports. So the Charting the Life course framework is a framework that has key principles that you can use for driving transformational change. It also has become a language and a set of visual icons that help people learn and talk and share ideas and problem solve and plan. It does have a set of actual tools that you can use one-on-one with individuals you support, and you can also use it in team meetings or for large stakeholder events. And along with Charting the Life course is this big national movement of people utilizing that. So we want to continue to grow that network and connect peers together to learn about this. So what is Charting the Life course? It was created by individuals with disabilities and their families, and was created for people of all ages. and it was created for all abilities. So it's a set of tools and ideas that help push people in terms of learning about possibilities, navigating the future, thinking about their vision and advocating for it. And it's also a set of problem-solving strategies that I'm going to show you in just one second. I'm putting this slide up for two reasons. One, I'm going to do a plug for the national showcase that's in a couple weeks. So this is typically in person, and over 500 people from all over the country come together to learn and talk about how they're using LifeCourse for person-centered planning and strategies. You can see on that slide the number of bullets. What this is showing you is all of the different disciplines or target populations or type of professionals that utilize LifeCourse and come together. So we group people together around really kind of what brings them to the table: education, long-term services, person-centered planning. We're really excited because this year we're honing in on the front door to supports. And so a lot of you might be interested in that, or the person-centered planning one. So hopefully you see yourself in that list of different ways that people are using this across the country. The other thing that the LifeCourse framework does for us is it enables us to really hone in on different life domain areas. So these are our big 6 life domain categories. And each month, David and I are focusing and honing in on one of those domain areas. So we focused on social and spirituality when we were thinking about social isolation. Last month, we were focusing on housing and technology for at home. So we focused on community living. This time, we're focusing on healthy living. And we will have follow-up ones that start focusing on the other domains as well. So we hope you join us for all of the domains that we'll continue to address each month. Specifically, as it relates to charting the LifeCourse healthy living tools, we do have a set of tools on our website. And in those tools are tools designed to help you talk about and develop goals related to the healthy living. In addition to the key set of tools that you see there are the tools up on the right-hand side. That's probably really small print for you to see, but those are actual tools to help people plan for going to the doctor. You take it to the doctor with you. You have the doctor help you fill it out. And it's a front and a back. So you're seeing front and back there. These were designed because we know so many people that go to the doctor's office are often supported by a family caregiver, maybe a paid direct support professional. And sometimes the information is lost in translation or in communication. So this document is designed to really help somebody plan going to the meeting, during the meeting, and to convey that information after the meeting. So that's just one example of the ways that you can utilize these tools. I want to specifically talk about the trajectory towards health and wellness. And Candace, a colleague and friend of mine, said I could share this with her because she recently trained a number of individuals with developmental disabilities to utilize these tools, as well as direct support professionals. And as you can see from these tools, it's a way for us to really think about what does healthy living look like. And you look all the way on the right-hand side, and not only do we want to have a healthy vision, how does that help our vision for a good life there? So you see that Candace's is spending time with her family, having a social life, and she knows that she needs to have some health goals related to staying healthy in order to achieve that good life. What we also really focus on is sometimes it's easier to articulate what we don't want. Because when we're really thinking about the technology we need, we also want to make sure that the technology or whatever supports we need for a healthy life aren't taking us in the direction towards what we don't want. So she wants to be comfortable in her own body. She doesn't to be so tired she can't have a social life. She wants to be respected, and she wants people to have high expectations for her. So these are all really important things to consider, whether you're planning for technology or any types of outcomes or supports. When we utilize these tools, though, we then move and talked with Candace about what are some of her past life experiences. Above the line are the things that are helpful to her in terms of having health and wellness. But the things below the line are the things that actually take her in the direction she doesn't want to go. She doesn't want to experience waking up in the middle of the night, saying yes to everything. And so we utilize that column of this tool for that conversation. You can see here is when we can start really honing in and saying, what is it that I want to work on? You know, I want to take care of myself. I want to be distracted by social media. I want to be outside. I don't want to forget to take my medications. I'm sharing this with you because all of this sets the stage for really determining what type of technology or what types of supports will help her achieve and support her healthy living goals. The next tool that we often then move into is what we call our integrated support star. And I don't have a ton of time to really dig into this other than to tell you, this to me is our problem solving star. There's 5 components of this star. So technology be the one that I'm going to end on. But when I'm sitting down with Candace and trying to understand what is important to Candace, I can run through each 5 aspects of the star. I can think about her personal strengths. I can think about her relationships. I can go around the star and think about what eligibility specific supports can help support her health. Think about the places she goes in the community and think about the technology she can use to support that. So as you can see here, this is Candace's problem solving star. She put down her personal strengths and assets. These are the things that she can do. She can take her medicine when she's supposed to. She knows how to speak up for herself. But she also knows in the purple triangle that she has families and friends that she can count on to talk to about her health or to help her make health decisions. When you think about her eligibility specific support, she has health insurance that she relies on to help pay for her health insurance. What is she utilizing in the community when it comes to staying healthy? The park, the doctor's office, Pilates. And you also see here, she's reliant on technology. The reminders to take her medicine, her Apple Watch, her cell phone. So it gives us a really good sounding board of where to get started to support Candace if we're trying to think of other types of services and supports and technology. This is what we call a starter star, or what I would call a cheat star. And what this star is on the LifeCourse tools is we have lots of different stars specific to that domain. So maybe you're having a hard time problem solving and brainstorming with somebody about what it is that they have in their lives to support them right now around being healthy. This will help you generate ideas for you around each part of the star. As you can see up on the technology part of the star, these are just some technology ideas, and David's going to go into them much further. But if you think about it, you can use technology for lots of types of health. Your oral health could be electric toothbrush, right? We just talked about your emotional health and that robotic pet. Social media could either be good or bad for your mental health and your emotional well-being. You know, utilizing your cell phone to call people and stay connected. So all of these forms of technology can support different aspects of your health. So with that, I'm going to pass it over to David, who's going to now hone in specifically on that part of the star.
All right. Thank you very much, Sheli, and good afternoon, everybody. Very glad to have a few new people joining us today, plus all of you that have been on some of the others and listened to us talk through ideas for assistive technology for social isolation. And then last month, we talked about smart homes, and hopefully some of those ideas have stuck and you are kind of beginning to explore some of the things that are out there. So before I kind of jump into the subject at hand, which is technology and assistive technology that can be used for helping us control our health at home, just a little bit about me. And if you've been on some of the others, I've updated my slide here. So I'm the director of Missouri Assistive Technology, and I've actually been working in the field of assistive technology for nearly 30 years. And the last year, like everybody else on the call here today, has been an extremely interesting one because I have been trying to help my mother get through the pandemic, and but I have also for a number of years kind of been trying to get my mother, nudging her along into the world of technology. And so, this is more than just professional to me. It is also personal. A lot of the stuff that I kind of do here at Missouri Assistive Technology actually applies not only to my mother, but friends and other family members as well. So if we move on to the next slide, I have to have a brief disclaimer here today because we are talking about devices related to health and healthcare. And the disclaimer is I am not a doctor. I am not a health professional. I'm just an assistive technology guy. And there is nothing that I'm going to talk about today that should be misconstrued as health advice. And there is absolutely nothing that should prevent anybody from having regular contact with their health provider. We're just going to kind of look at some of the tools that are out there that can help people maintain and understand their health a little bit better. So if we move on from the disclaimer slide there, just thought that was kind of important that like I said, I'm not a doctor, and you should have a good, solid relationship with your healthcare professional. So when Sheli and I set these up, we wanted to talk about technology, and we wanted to talk about assistive technology. And in the course of our conversations, it's more than just the devices. There are all sorts of great ways that we can use kind of the mainstream technology that's out there to be able to get additional information on the various subjects that we talked about. So I want to start by talking a little about some of the resources that are online that I would suggest people become familiar with, that we encourage the folks that we work with to become familiar with as well, because there is a ton of these resources out here. And so I just put a handful of them over there on the right-hand side. And these are a series of websites that I find myself going to, that are vetted, that are extremely respected. And they're great tools for a lot of reasons. They're great tools because they are solid in terms of the information that they provide. And so let's use Medline Plus as an example here. This is actually a federally funded website on healthcare related issues. So if I go out to a site like Medline, I'm going to find information about health topics. So I can find information about maybe my particular condition. I can find additional information about drugs that maybe my healthcare professional has prescribed for me so I can understand them better. There is information about medical tests, for instance. So I went to the doctor said, we're going to run this test. I want to learn more. So these websites that are out there, like some of the ones listed on the right-hand side, are great resources for helping expand a person's understanding. Because one of the things that we definitely want to do is have people be knowledgeable about their health and have their health in their control. So I highly encourage that people go out and spend some time on some of these sites. If we move on to the next slide, the world as we know it has changed in a lot of respects. And how we handle health care in the United States and the types of resources that are going to be available is one of the things that's really, really going to change going forward. And so another important resource that's just kind of standard technology now is all the telemedicine resources that are available. And I assume that a lot of folks have some familiarity with this. And this was something that was in works before COVID, but we're probably not going to go back to the doctor's office being the place that we physically go. We have kind of pushed this technology 5 or 10 years down the road, and it will become kind of the standard. And so if you're not familiar with things like Teladoc or MeMD, or you have individuals that are not comfortable with using these would be good things to make sure that you are exposing individuals to. There's a lot of reasons that these are useful, probably for people who are older or people with disabilities. One of the primary reasons that some of these platforms are really valuable is because it helps them overcome the transportation situation, or it also helps with cost saving, some of these platforms and how we can use them. A lot of hospitals and local doctors have begun to kind of set up their own resources that are sort of based around virtual. And then you still have the standard nurse helplines that are out there, which you can actually access via telephone for those folks that may not be overly familiar with using some of the online resources, but still want to have some of those equal services. One of the things that when we look at these, and this is kind of an advocacy issue, it's also kind of an assistive technology issue. Some of these companies have done really well with making these types of platforms accessible to people with disabilities. That should always be something that we kind of look at if we're exposing individuals to these, is the accessibility of some of these platforms and other sources that are out there. All right, so I just wanted to kind of, if we move on to the next slide, just want to kind of introduce folks to some of the broader resources that are out there that are quality, and a little bit of, where the future is going and these virtual platforms that we will increasingly use in the upcoming years. So today's piece, I actually had a lot of fun putting this together because I've kind of been paying attention to some of these devices that were coming out on the market, had some familiarity with them, but I'd never really kind of sat down to do a deeper dig on the amazing array of technological devices that I can now use at home to help me maintain and improve my health and kind of collect data on myself so that I can lay out steps and goals to maintain my health. So let's start by talking about pill organizers. And which is technology for medicine is kind of the way that I originally described this. Med management is a struggle. It's a struggle for a lot of people, and adherence to our medications is incredibly important. Any number of reasons. Obviously, you're prescribed a medication because it's part of the regime to get you back to being healthy or to maintain your health. If we don't have the ability to maintain our regime in terms of our medication, then that also means that somewhere down the road, we're going to exacerbate our condition or we're going to see greater costs in our healthcare. So I have three really quick examples here of some of the devices that are out there on the market that are worth being more familiar with in terms of med management. The first ones are pill organizers. There are a lot of reasons that people have difficulty remembering to take their medication. And one of them is just plain organization. And I can think the gentleman that lives across the street from me has a terrible time remembering to take his medication because he keeps getting these prescriptions and they come in these little vials, et cetera, et cetera. And so one of the things that we've been working on is using some of these pill organizers. So just two examples, there's countless dozens of these. But what I want to point out to people is that there are a number of these pill organizers that have been designed around a strategy or an accommodation that can help somebody. So on the left-hand side there, where it says the rainbow pill holder, the idea there is that I put my medication in for the week, and there are little subcompartments in each one of those days. So if I take it at multiple times throughout the day, I have all my medication in there. But that's using a color coding strategy, which can be effective for individuals who have various kinds of cognitive issues. I can then put all my medications in there, or I have somebody help me put my medications in there. And then each one of those days I can slide out and I can carry it with me. So I can put it in my backpack, I can put it in my purse. But the strategy there is a solid one for helping people remember what days worth of medicine, whether or not they grabbed it out of there. On the right-hand side is another example. Pretty much does the same thing. It is a week at a time medication holder, and it is one that's designed for people that are blind. So they have the ability through tactile, there's also Braille on there, to know what day of the week it is, what time of the day it is that I'm going to need to take that medication. And it's all very neatly organized. And that's part of the strategy that's really important to making sure that people adhere to their medication. If we move on to the next slide, a couple of examples here of remembering to take our medication. This is another common struggle that a lot of folks have. So on the left-hand side there, we have a device called the Med Center Talking Alarm Clock. It's essentially like a butler for helping you remember to take your medication. So you put in there the various times of the day that you're supposed to take your medication, and it will sound an alarm. It'll be an audible alarm, so it will speak to you, and it will say, David, you are supposed to take your medication. It's 2 o'clock. And I can have multiple reminders throughout the day. So it's kind of an auditory, I could be somewhere in my house or in my office, this goes off, I'm reminded to take my medication. On the talking slide on the right-hand side, a lot of times we stick our medication, we grab the pill bottle, we stick it in our backpack, we stick it in our purse, we throw it in the car, and we say, okay, I'm going to remember to take my medication. The taken slide is a little adhesive strip that goes on the outside of the pill bottle. So if I've gone to the pharmacy, I've grabbed a pill bottle, I can put one of these, this is maybe the only medication I'm taking, I can put one of these strips on the outside of the bottle. And there's a couple of different versions of the take and slide out there. This one is designed for folks with visual impairments, but as they take each dosage, so say they're supposed to take 4 dosages in the course of the day, very simple little way to know that to remember that I've taken that. And that is that you just slide the little lever there from one side to the other. There's another version of this that's actually color coded, so I can see visually that because the slider turns green, that I've taken the medication, and that just helps you stay in your regimen and make sure that those medications you're supposed to take that day were taken. Another problem, if we move on to the next slide, that there are some good solutions out there for is medication assistance. Not all of us can swallow a pill, or maybe due to the fact that we have some dexterity issues, we find it hard to apply eye drops. So on the right-hand side there, we have something called the Autodrop Eye Drop Guide. And it is designed so that if I have eye drops and I'm supposed to put in several times a day for my condition, I slide it into this little holder. And the way they designed the holder, it will line everything up ideally, and it actually kind of holds your eye open a little bit, and I can more easily be able to apply the eye drops. That might be useful for somebody that has some dexterity, some mobility issues. I'm thinking of people who have tremors and those types of things as being a group that could benefit from this. If you are unable to take your full-size medication, if you can't swallow a pill, or the pills that they prescribe are way too big and about the size of something you'd give a horse, then but maybe it's very difficult for you to crush those up. The Silent Night, which I think is creatively named, is a pill crusher. That's all it is. But it will enable me with very little pressure to be able to reduce the size of the medication. And I can actually do multiple pills at one time, and I can have individual pouches that go in there. So all those medications that I'm supposed to take over the course of a week or throughout a day or whatever, I can do them all in one fell swoop and have them in a manner that I am then able to swallow. So just 3 examples of some of the things that are out there to help people who struggle with managing their medication. And next we're going to move on to some of the sort of standalone, pretty cool devices that have come out over the course of the last few years. And while a lot of this is going to be practical, one of the things that I kind of want to share with everybody is this is also kind of a think piece. And what I mean by that is we are at the tip of the iceberg in terms of this type of technology and where it's going to go down the road. It's only been the last couple of years that we're seeing most of the technologies that I'm going to share here today begin to come out on the market. So what does that mean? It means that there'll be a lot of really positive evolution. It means that there's a chance, an opportunity for people with disabilities to kind of maybe get familiar with these and advocate for improvements on accessibility, which we always strongly encourage. And it also means that we will unfortunately kind of be watching this over the next couple of years to see what's really practical and what's not so practical. And I'll highlight 1 or 2 things that I'm kind of curious where they go over the next couple of years as I go along here. But we're gonna start looking at a common thing that a lot of us need to do on a regular basis, and that's monitor our blood pressure. And there's a variety of reasons that we monitor our blood pressure, all based around the idea of making sure that we stay healthy. And I believe I have 3 examples here. This first one is something called the BPM Connect, and that's actually the name of the company. And it's a blood pressure monitor that is Wi-Fi enabled. And so I don't have the cords, I don't have to do the little pump up thing. I just wrap that around my arm like you would a traditional blood pressure monitor. And you'll see that there's a little white strip along it. Actually, it's kind of, I don't know how I would describe that, but that's the rest of the unit. So I get that around my arm, and there's a little button that you can kind of see towards the bottom there, and one push of the button and it's going to go through the process of taking my blood pressure. And then my blood pressure is also my reading is going to show up, and it's going to show up there on a screen that you can't quite see here in the picture, but is also built onto that white strip. Not only is that really handy because I'm getting immediate feedback, but the fact that it's only 1 step and all I have to do is direct select, push that button, I think is really convenient for a lot of folks that might struggle with physical issues. But the color coding I think is good because, again, I get immediate feedback, but I get it in sort of like traffic lights. So if I get a green reading, I know I'm in a safe zone. If I get a yellow reading, I need to be more aware. And if it's red, then maybe I need to take some kind of action and kind of make sure that everything's all right. The other thing that's really nice about this and several other of the devices that are out there is a lot of them, if not all of them, actually pair with an app. So if I have a smartphone, then I can get the corresponding app and I can then subsequently just immediately download the information into the app. That's good for me if I have goals that I'm trying to set related to maybe getting a condition under control. It's also really handy when speaking to your medical professional because you have right there in front of you the information that they will probably find incredibly valuable. So let's move on to the next slide, which is another blood pressure monitor, only just a little bit different take. This is one that is wrist mounted. And so this might be more convenient for some individuals. Some of the things that I like about the HealthSmart blood pressure monitor is it's easy to see. It's right there. It's got an LCD screen. It's got good visual feedback in terms of, again, using some color coding, but the readings are fairly large. On the BPM, the readings are a little bit difficult to see, but this is nice and clear. So this might be useful for somebody that has some vision related issues. It can be used by multiple people. It will average the last 3 readings. So again, if you've got some goals or you're concerned, you've got some immediate feedback there as to how you're doing and maybe getting your blood pressure down. Also has the ability to detect irregular heartbeats, which might be useful information. The fourth thing that I really like about this particular one is I can get it in English or Spanish. I don't have to buy an English version versus a Spanish version. It'll do both. And it's important that we open opportunities for everybody to be able to receive their own personal information in a language that's convenient. Relatively priced, I think, at $75. So, and one of the things that I discovered in the course of my research that I thought was really interesting is that people that have health savings accounts and then those tax deferred things, which I can't remember what the name are right now, you can use those to pay for these. So just an FYI. And then if we move on to the third slide here, just another version of kind of the technology that's coming out related to monitoring my blood pressure. This is the iHealth Smart Wireless Tensiometer and Monitor. I'm not going to go in depth here, but the things that I liked about this particular one from sort of a disability perspective is the cost. It's $40. It does use a cuff. It's just not illustrated here. So it's kind of a little bit old school, but I really liked the color coding and the large text and the way that the backlight of the LCD kind of makes that information pop out, which might be useful for me if I'm somebody that has some vision related issues. So it does blood pressure, pulse, which is important, and then also has the ability.
Maintaining is not a bad thing, period. Dad used to say that all the time, comment LOL, period.
All right. I'm not quite sure where that came from, but if we move on to the next slide, we will change gears here. This is actually an example of something I'm kind of curious. I'm going to keep an eye on, and I don't know if this is a trend or if this is just somebody that's entered into the market thinking they have a good idea. This is a portable EKG monitor. EKGs, at least up until the time I came across this, I was under the impression that's something you went to the hospital and they put a bunch of little diodes all over you and did it in a much more controlled location. But this will actually fit into your pocket and give you apparently the same information. What attracted me to this, not only was it was novel and it's FDA approved, which spoke to me a little bit there. But the ease of use on this thing was amazing to me because it's an app. So I open up the app and then that little triangular piece that has the 2 gray squares there on the bottom, All I do is I set that on a table, put my fingers on it, and it will take the reading. And again, I can track this stuff over time. And if I know myself well enough and I kind of understand what I'm supposed to be looking for, it can help me monitor my condition. All right, so 4 things related to heart. And so there are more devices coming out that help us with blood pressure and one thing and another. And if you want to read up on these, again, some of those sites that I went to, I thought were really interesting because they actually kind of touched on this topic of portable home devices. So let's change gears and move on to the next slide and talk just a little bit about something that we have all become incredibly familiar with over the course of the last year, and that is having our temperature taken. Okay, that is not always the easiest thing for a lot of people to do, especially if I'm using sort of an old school thermometer where I'm putting it under my tongue and I have to hold it there for a couple of minutes. And if you look at some of the digital thermometers that are out there, you know, they have a squeeze trigger, some of those kinds of things. And I thought this was kind of cool. This is called the Thermo. While it's, I'll confess that I thought it was kind of cool. However, I did read deeper on this thing because of the fact that it has to be more than cool for it to be good. And this is a handheld thermometer. So I would just take that little green bottom. Let me try that again. Over on the right-hand side, you will actually see the thermometer. And there's a green area there at the bottom of the thermometer. So I take that off and I just put it up around my forehead. And it measures, they refer to it as a temporal thermometer. And so there's little sensors in there, and I believe there are like 14 or 16 sensors. And so I'm moving it around, and it's actually doing all sorts of magic up there. I can't remember how many measurements it takes, but it was a fairly impressive number. And it takes about 10 seconds for it to actually get the reading, which is, again, considerably less time than your traditional thermometer that takes a couple of minutes to put under the tongue and somebody has to sit there patiently. It uses color coding again to help me understand where I am in terms of my temperature. So if I'm in the green, I'm fine. If I'm yellow, maybe I'm starting to get a little bit of a fever. If I'm red, then I'm probably in an area that I need to be concerned about. It pairs with an app. So again, I can kind of, check my temperature over a prolonged period of time and remember the data, and I don't have to write it down somewhere. It's contactless, which is a good thing in this day and age. I did find it a little bit expensive at $100, but I like the design of that because it's one button. I turn it on. I can use it externally. It's got that color coding, and my temperature shows right up on the device. So this is something I'm sure there will be some similar versions of this coming out on the market, but this is the first one that I've seen out there that kind of does this kind of, that has this kind of technology in this convenient package. I think it, anyway, there's some other things I could speculate on about this, but in the name of time, we'll move on to the next slide. Diabetes. Diabetes is a serious health concern in the United States at this point in time, and the numbers continue to be concerning to a lot of individuals. And there are quite a few individuals with disabilities that have diabetes, and it's critically important, as we all know, to be able to easily and reliably monitor your blood sugar levels. And this is the Prodigy Autocalc, and it is a talking glucose monitor. And it is going to predominantly be used by individuals that have vision impairments because it's going to provide auditory prompts. So not only will it give me my reading in an auditory format, but all the steps related to taking that reading in the first place are presented auditorily so that it walks me through from beginning to end as I'm doing the process. It seemed to me to be a pretty useful $50 investment for a lot of folks who have vision impairments who struggle with maybe using some of the other devices that are out there. It's also a very simple face, and it has easy to identify tactile buttons, which are important. And I think there are some other talking glucose devices out there, and this is an area that I think more people need to be aware of. It's, because monitoring that blood sugar levels is a big issue. If we move on to the next slide, this is another portable glucose monitoring system. And this is from a company called iHealth. And if iHealth is probably considered a leader in this field of these personal use monitoring devices for wellness. And if you aren't familiar with them, you might spend some time on their website getting more familiar. They have a number of devices for a number of conditions. And I think they'll be a company that will be around for a while and be a player and develop some even more effective and useful devices. This is just really a digital twist on the conventional glucometer. And it pairs with an app, and it has a logbook. And so again, I keep coming back to this, but this ability to pair something with an app and have that information so I can easily refer to it is huge. I know that I personally struggle with remembering any of that type of information when I'm taking it. I scribble it down on pieces of paper, and then I'm almost worthless when I actually am talking to my medical professional because of the fact I can't recall specifics and I didn't put them all in one location. So I think that's a great trend. The other thing that I thought was really interesting about this is that there's a QR code. And I was unaware that the test strips have an expiration date on them. So before I even use that test strip, I can take a little QR code off of my phone, and it will tell me whether or not it's a current one, that it hasn't expired. And I thought that was a nice little piece that's added to this particular one. Totally, it's small, it's convenient. You can take it with you anywhere. It can be used discreetly, and it's costing about $30 right now. So that's just for the device. The app is free as well. So that's a really low cost, but seemingly to me to be an effective way of being able to make sure that I'm monitoring my glucose level. All right, so let's move on. And let's talk a little about some of the devices around maintaining a healthy weight and setting goals. And we're seeing a whole bunch of stuff coming out here. So I'm just going to highlight one of these, and this is the iHealth Nexus wireless body composition scale. So say that 5 times fast. I'm just going to call it cool. And this is not the only device of this nature, but some of the things, it's important if we are maintaining our health to have goals, to set them, and to work towards them. I'm sure pretty much everybody that's on the call today has done that at some point in time. You have decided that you're going to lose 10 pounds, 20 pounds, 5 pounds, 100 pounds, and you've set a goal and you've set out to do it. And the way that they're designing a lot of these devices, I think it makes it a lot easier to actually set and keep goals. But these devices are starting to do a lot more. The traditional body scale, or the traditional scale, you get on it and you get a number, and that's it's either going to go up, stay the same, or go down. But some of these newer devices that are coming out for measuring weight are doing much more than just that. And this is a great example of that. While I can track my weight, I can also get information on 9 other aspects of my body composition. I can't recall what all 9 were, but it does things like BMI. It has the ability apparently to measure percentages, like how much. Okay, I'm going to stop there because I'm going to butcher that fact. But the point is that there's a lot of good information that is beyond just measuring my weight related to my body composition, and I can get that feedback from this. And it's about $75, which I thought was fairly reasonable. And again, I can collect that information and use it to help me stay on course with various types of goals that I've set related to tracking my fitness. Again, not the only one of this kind that's on the market, but I think that this is a really encouraging trend as we've built in more than just monitoring our weight. If we move on to the next slide, then this is, okay, there's a whole conversation we could have just on trackers, wrist-related trackers. And I'm sure that we are pretty much all familiar with the Fitbit and the Apple Watch and all the great things that they can do. And a number of the things that I actually have discussed related to like blood pressure, you can monitor your heart off of some of the devices like the Apple Watch and the Fitbit. But some of those devices can be really expensive. For instance, if I wanted the Apple Watch, I have to have the Apple phone. And all of a sudden I find myself talking about laying out $700-800 to have both. So the challenge that I kind of put myself on when I started thinking about fitness trackers was, what can I find that's a standalone fitness tracker that can give me that information that I'm seeing on a Fitbit or the Apple Watch? I personally am not a watch wearer, but I like to track my exercise in one thing and another in a day. So I actually kind of had a selfish motivation here. This is another one by iHealth. And there's probably about a dozen of these, but these are standalone activity trackers. So I can put it on when I'm going out to get my activity, and then I can just, take it off and walk away from it. I thought it was relatively priced at about $80, which I believe is cheaper than the lowest priced Fitbit. And those are kind of reasonably priced. But if I'm a swimmer, it can track that information. It can monitor the distance I've traveled if in terms of taking steps or running. I can measure my sleep quality with this, which I think one of the undervalued things when we talk about health is sleep quality. That is obviously tied to a lot of issues, and it'd be nice to see more devices coming out focusing on that. It's also very useful for helping me be able to set goals and work towards them. And it provides some alerts, and I'm kind of a big fan of the alerts because sometimes we need to be jarred back to reality, that maybe we've been sitting too long and we need to get up and do something to make ourselves healthy. So the iHealth Wave Activity Sleep and Swim Tracker would be an example of one of the dozen or so standalone tracking devices for fitness and health. If we move on to the next slide, then this is a total think thing. For lack of a better way to describe it. I just thought this was really interesting. I don't know how practical it is. It is expensive at $300, but these people may be on to something here. So this is the Oura Ring, and you will see from the picture, it has a number of sensors that are built in. This is actually an activity tracker in some levels, working off of those sensors that are built in. But their whole philosophy here, and if there are some healthcare professionals, please chime in the chat, because I'm not sure if this is solid science or not. But their whole thing was, okay, first of all, wristband things, they didn't want to do that. But they also were pointing out in their advertising that when you go to the doctor and they're taking your blood pressure, they put something on your finger. So that's why they've gone with trying to find a device that goes on the finger, or part of their philosophy. I don't know. Again, I just thought that was interesting. But what seemed even more than just interesting, but also important, was that this is tracking 12 different pieces of information that I might find useful, related not only to my activity levels, but my sleep again, and then also something called readiness, which is sort of related to my energy level and where I am and how I'm dealing with things in my immediate environment. So maybe not something I'm going to rush out and buy today, but definitely something I'm going to keep in mind, because what we see a lot in the world of assistive technology, or technology in general, is that somebody comes out with something and that disappears, but there's pieces of that thing that a company came out with that get applied in other areas because they have great value. And I think there might be some things contained in this ring. So let's move on. I also like the ring because I'm not Game of Thrones. I'm a Hobbit fan. Anytime you can have a ring, hey, that's cool. All right, and this is another area that I think has great potential, and I'm going to keep an eye on these. And these are portable or wrist-based. Some of them can be clipped onto my belt. There's a couple of different ways that they can be associated or put on a person. But these are emotion detection devices. And this one's called the UpMood Watch. And it does one thing, and it just tracks my emotion. But it measures the heart rate, and that should be heart rate patterns, not heart rate patterns. And through a series of algorithms, it is taking that information related to my heartbeat, and it is helping to help me understand what my emotions are at that point in time. So am I getting am I getting am I happy? Am I getting anxious? Are there other things going on that are either healthy or not healthy emotions that through its detection of my heart rate, it's helping me to understand? And if once you pair that information with the app, you are actually getting insight that you can look at in the app to kind of help you understand where you are emotionally, but then it also provides you with some action steps that you can take to get yourself back into an emotional state that would be appropriate for a situation. So if you're feeling anger and it's telling you this as you look in the app, then it's going to get you out of that state. It's going to make some suggestions as to how you can get back to a calmer state. I think there's a lot behind this idea, and I hope that this is good, solid technology that we'll continue to see develop over the next few years. But this is the Up Mood Watch if you want to kind of read a little bit more on this type of technology that's coming out. All right, next slide, please. And this is, Mom was right. And I was thinking about this a lot as I was putting together the presentation, because we have all been sitting. I mean, we sit a lot anyway. In the course of the last year, we've all been sitting even more. And we all know, I think, that there are issues related to our posture that can cause us difficulties later on down the road, related to our necks and our shoulders and tension and one thing and another. And this is the Upright Go Posture Trainer. And it's a little device that I attach. It seems like the most common way I saw it attached when I was researching was with a little harness, and it fits on the small of the back. And so it's just up there right below where, kind of between my shoulder blades. And so if I am in a position for too long, or it's detecting that I am slouching or slumped over or something of that nature, then it's going to give me a little vibration to tell me to straighten up. And I just thought that was, not only was I thinking there was some application here, but I had to laugh, because if I had a dime for every time my mother told me to straighten up physically, then I would have been a rich person. And I wish she'd invented this, because then she would be a rich person. So anyway, interesting idea. I think there's practicality to it. And another thing that I'm going to watch as the time goes on, but it is actually available right now. All right, so if we move on to the next slide. Okay, so we've looked at some things for blood pressure monitoring. We've looked at a portable EKG. We have looked at a number of devices, fitness trackers, glucose med management, probably about half dozen, maybe a few more categories of some of the types of personal devices that I can have at home to help me be able to monitor my health and hopefully set goals and improve my health. When we've done each one of these sessions, we've kind of tried to introduce a broader assistive technology concept in each one. And so we've introduced this slide in the two prior ones. And one of the things that we always want to look at when we're talking about assistive technology is, where does it fit on the technology scale? Because the less complex, the easier a device is to use, you're going to have more success. People are going to be motivated to use it. And one of the things that I thought was interesting when I was placing a number of these devices that we just walked through on the technology scale is that they look like they are actually high-tech devices, because for a variety of reasons. But a number of them, I really felt at worst were in the mid-tech area. And ideally, I think a lot of them are in the light tech or the low tech, where they're not overly complex and they're really not as sophisticated as they kind of appear on first blush, and they're relatively easy to use. And so I was pretty encouraged by that, because that means that as people adopt them, people are going to understand them, be more motivated to use them, and hopefully tie them to other things that they want to do to improve their health and their participation in the community. So if then one more slide here. In this session, I want to kind of introduce another concept here, which is feature matching. And one of the things about assistive technology, or technology in general, is it's really easy for us to all get caught up in the bells and the whistles. But we always need to have in the back of our minds some reason that we're doing something related to technology and in assistive technology in particular. So there's a concept in assistive technology that we refer to as feature matching. So if I am working with an individual, so let's go back to Candace, who we met earlier, and as Sheli was kind of walking through some of the LifeCourse health-related materials, if I was working with Candace and I was going to try to feature match some health devices for Candace, the first thing I'd want to know is, what are the features that you need? You know, does it need to be simple? Does it need to be color coded? Does it need to have auditory feedback? What are some of those things that you, Candace, are going to need to be able to use this device? And then what are you going to be able to do? So the next bullet point, individuals' abilities and needs. So, you know, Candace, what can you do? You know, is it, if I do a blood pressure cuff that's on my arm, is that something that you can activate individually by yourself? And then where am I going to use it? A lot of these things don't really necessarily apply as much to the environment because we're going to be using them at home. But within world of assistive technology, where a device is going to be used can be a determining factor in matching up to the device. And then what are the activities and tasks that I need to monitor, that I want to accomplish using that assistive technology? So these are just, you know, again, the feature matching thing, you know, further on down the road, we'll go more into these types of things. But the key thing to get out of this slide is, it is important to know why you are matching a piece of technology up with an individual and not just getting excited about the technology. So Sheli, I believe that's my last slide, and I will pass it back over to you. Oh, shameless plug slide, but if you're not familiar with us, at.mo.gov is our website. And certainly reach out with any questions or additions or anything more you want to know about these devices or just technology in general.
Thanks, David. That was great. You had a couple questions in there. It was the taken slide reusable was one of the questions. And that was the pill box. I don't know if you know the answer to that.
Actually, that's a great question because I had the same one. There are a couple, like I said, I think I said this, I hope I said this. There are a couple of versions of that idea. There's one of them that sure appears to me to be, well, let me take that back. It could be, I can't verify that, but it sure appeared to me that the one version of those could just be taken off of a pill box or a pill container and put on another pill container. So I'm thinking yes.
All right, very good, thank you. If you have other questions, obviously you can contact David and I at any time. Obviously have to plug in our next ones. We have May and June. May is more about things to do around your house to prevent falls. We know that's a major issue, and how can we prevent those? In June, we'll be focusing on you know, people that, you know, communication is a key issue. So we wanted to focus on the side of how are people using their computers or even print products, and how, if they can't read or they can't see it visually, what are strategies and technologies that can support people to be able to utilize the things that are sent to them to communicate either via their computer or hard prints. I'm also doing a shameless plug on the showcase. If you have questions about what that is, there's information on our website. There are a number of opportunities available for scholarships or for attending. So just email us and be in touch. A lot of the tools that I talked about are online, so I think Miranda put them on there for you. We will also be posting each one of these webinars on a website so that you can access them or share this information with others or go back to it or check out the slides or whatever. So again, we really appreciate all of you attending. I believe that Miranda will put up a poll if it's not up there already. We thank you for your time. We know how valuable your hour is. We're glad you spent your lunch with us, and we hope that you'll join us at the showcase, and we hope that you will also join us next month for our next topic. So thank you and have a great day. Hey, David, I'm gonna have to circle back to you another time. I have to get on that big CMS call at 1:30. So, but
All right.
great job.